So Kip Woodward sent you a letter back in October 2009 suggesting a whole bunch of reforms for the healthcare system and specifically Providence Health Care. And among those suggestions was that Providence Health Care be allowed to bid on services, on the services of private healthcare clinics. As you know, though, he's also an investor in a private healthcare clinic. So, I'm wondering, do you see a perceived conflict there?
Not at all.
Why?
As I've said from the very beginning, and this is something that was brought up when he was first appointed as chair of Providence Healthcare, actually, the public sector unions raised the issue that he has a family company that does have a small interest in one of the private clinics. I believe it's Canby. He's always been upfront about that. He's always adhered to whatever conflict provisions are in place in terms of disclosing his interest. I can tell you this, though, Kip Woodward has been an outstanding chair of not only Providence Health Care at no cost, he's accepted no remuneration, but is also serving now as the chair of Vancouver Coastal, again, at no cost, no remuneration. And he is bringing forward ideas, as I have asked all health chairs to do, and in fact, I've asked doctors and nurses and the members of the public to bring forward ideas on how we can have a sustainable healthcare system.
But doesn't it put him in an awkward situation, having a stake in a private surgical center and then suggesting that Providence Health Care be allowed to open up bidding for services of private health clinics?
No, I don't think it does, because again, he's disclosed completely that he has an interest through a family company that he's not involved in the day-to-day operations of. And as long as you disclose the interest, it doesn't mean that you must never have anything to do with even commenting on whether private clinics can be used or not. The fact of the matter is, ironically enough, the people most upset about this apparent issue is the NDP and their public sector union leaders, friends. And the fact that the NDP is opposed is humorous, to say the least, because they are actually the party that actually approved the private clinic, of which he has a small minority interest in. So, it's just politics. The fact of the matter is, Kip Woodward does an outstanding job. He will continue to do an outstanding job for us, and I am thrilled and pleased that he is actually bringing forward ideas to help us deal with how we manage the healthcare system.